So he has an aggressive sort of presentation, but also you can see the stupor, so in coordination, sort of. So it's very important to keep up with your titer, especially in this profession. You don't want to get bit. Yes.
Can you sedate, like, I know cats are bad, it can be bad. Anyway, especially rabies cats, can you sedate them before you euthanize them?
I would recommend that, or else you might get your eyes clawed off.
I didn't know whether the CNS hyperactivity, you know.
No, it typically wouldn't affect the presentation. Poor animal.
I mean, honestly, that's like my cat.
Jasmine said that's how my cat is every day. Oh dear. Okay.
They might have raised
Yes, ma'am.
So, I know you said the bellowing is like a common sign in cattle.
Yes.
There's also a vitamin deficiency that causes that too, though. How do you tell the difference? Because I've seen one with vitamin deficiency, and I could have swore that cow had rabies.
Well, what else was the cat? Was he
It was
drooling?
like drooling, running around, screaming. Gave the vitamins, 2 days later, he was fine.
Okay, the fact that you did it 2 days later, I wouldn't even touch the
I
cow,
wasn't
but.
going to touch it. It was a large animal that was like, it's a vitamin deficiency, watch.
Oh. Well, that's the thing. That gives you the security at least you're vaccinated to handle that. But I don't take any chances. But I'm just I can carry it. Yes?
So typically they cut the head off of the dog, cat, whatever. In that case, with the deer, would it be appropriate to shoot it, take it out of its misery, or will that just spread things around?
I would not shoot it because again, exactly spreading things around is not a good idea. Like for instance, right now our lab, our necropsy lab will be closed for the next 24 hours. We don't even there's no real reason. We just want to make sure it's clean and disinfected. The virus doesn't last very long outside, but shooting is not a good idea. Even for large animals, we typically would use the bandsaw, and if you know what a bandsaw is, this huge thing you can run a head through, and it splits it in two. We don't do that. We'll use the axe and just hand tools to get less aeration of the virus. So I wouldn't recommend shooting, but I mean, if you're a regular person, what else? But I wouldn't shoot in the head. But you have to be careful about fluids and exposing it to other people. So, yeah, yes.
I have another story, just kind of same large animal bed.
I'm not working for this person. Who is this?
She had a llama that had rabies. How do you handle that because they spit?
Wow. Yeah, I would be very. I mean, this is where Jonathan's comment about sedation from afar. Because I didn't even think dark. Yeah, I agree. I didn't even think about llamas and spitting. Oh goodness, yeah. That you would have to be careful with that. Body fluids in general. You just want to make sure you have any open wounds, that sort of thing. Gloves, double glove. I double glove. And you know, but yeah. So what did she do? That's what.
She called DHEC and DHEC came out and dealt with it, but I don't know. She doesn't know how they like came out and actually did it.
Huh. They probably tagged. I mean, darted
They
the animal.
started the llama, but
Yeah.
yeah.
But the key thing is to make sure you're vaccinated. Obviously, when every vaccine is not 100%. I've had students with usually by 2 years, you should still be good. I had a student. We did her titer. She's like .02, and the normal is like .1. And I was like, what the hell have you? What happened to you? And then I had a student who was way high. That tells me what? She's been exposed. So I said, well, at least we don't have to revaccinate. That's comforting. So it varies, and it's very interesting to see. We just did the third year class, so it's interesting to see people's titers. Most people are at the good level, but AVMA recommends maybe 2 to 3 years. I do 2 because seniors are hard to find, so I can at least get you in one place to get it done. And they come here to do it. They take your blood, and then they send it out for diagnostics. Because again, if I ask you to go get it done, you know, people don't understand. You are here like from 8 to 4:30. And by 4:30, most things are closed. Now we're gonna look at any other questions? Herpes viruses, and the 3 include MCF, malignant catarrhal fever, infectious bovine rhinotracheitis, and pseudorabies. So you should have done all 3 with Dr. Gorham when we looked at the more of the CNS presentation, the GI presentation. So this is a review. As you know, there are 2 types. The ovine herpes 2 we see in sheep and outside of Africa, and then the alpha-scene herpes 1, wildebeest derivative you see in Africa. Herpes in general loves vascular systems. So you always have a vasculitis, you have some sort of petechiation, bleeding associated with it. So I'm sure he showed you the oral lesions, the ocular lesions, you have corneal edema, so you have this sort of opacity to the eyes. But they can have CNS presentation as well. So what we see as before, non-suppurative meningoencephalitis, so it affects both the meninges and the brain itself, and we see a vasculitis, so the vascular systems are affected. And predominantly it's going to be in the white matter, you're going to have perivascular cuffing. IBR, bovine herpes 1, again, also gives you that non-suppurative meningoencephalitis. So what is this showing you? What would be your morph for this picture? Severe diffuse. Okay, so we do definitely have its ulceration. So what's this white stuff on in the trachea? Fibrin, yes. So it's a fibrinous lesion as well. So why does fibrin develop with ulcers? Inflammation, you have degeneration of the overlying tissue, and it's also like a nice little blanket over that raw ulcer. I mean, I just always think of it like that. It's like a pseudomembrane, so it covers the predominant lesion. So as you can see, it's pretty significant, and these animals have issues with breathing. Pseudorabies or Jeske disease, also known as mad itch. You see this in pigs, and it's a porcine alpha herpes 1. Pigs are the natural hosts, but they do not typically show clinical signs. So it's usually see these in other animals that they are in a close association with. Some exceptions are two exceptions, baby pigs and pregnant moms. So sucking or young piglets, you get a fatal encephalitis. You come in and your whole litter is dead, and then you look at them histologically and you have encephalomyelitis. Pregnant sows, it causes abortion or mummification of the, or stillborn of the fetus. So those are the 2 exceptions in pigs where you do see clinical presentation with pseudorabies, but typically you don't. It causes lesions in the liver. So what is a common lesion for herpes in the liver? Multifocal hepatic necrosis. Sammy would be so proud. So this is a H&E section of liver. These are your hepatocytes. And we're looking at pyknotic debris and necrotic cells all throughout. And what kind of inclusions do we see with herpes? intranuclear inclusions. And so we don't see a lot of those, but there's one right here where you have this sort of scattering of the chromatin within the nuclei. As I said, it causes mummification and stillbirth to the fetus. And it can also infect cattle. Now in cattle and some dogs, we've had a few cases in dogs, it causes massive itching. So that's why they call it mad itch. These animals are constantly scratching and eventually they will be paralyzed and you see death associated with pseudorabies. What's a differential for a picture like this? You did reproduction. Parvovirus, very good. Prion protein diseases. Let's see, we got time. We got 40. Okay. So there's a list of prion protein diseases. Scrapies, one of the more common ones. Mad cow disease or bovine spongiform encephalopathy. We see there's one in mink, and chronic wasting disease in the deer. Okay, now I apologize for the volume. I'm not sure what's with the volume. Sounds like a devil is coming. I don't think we need to do that. Let's see it again. So what did you notice about the picture from what described by the Satan coming back? What do you see? Itching. What else? A loss of hair and alopecia. Is that due to the virus? Yes, so they're scratching to madness and it causes loss of hair in those areas. So this is an extreme form of scrapie, progressive wasting disease, prolonged incubation, no gross lesion. Even though we see itching, that could be due to multiple things. Microscopically, this is important. It's called a spongiosis for a reason. We do see vacuoles within the cytoplasm of neurons and glial cells. Absolutely no inflammation. That's important to know. There's no lymphocytes, no plasma cells, nothing. We see large vacuolated cells. It's typically bilateral symmetrical, so both sides of the brain, and it's limited to these areas: medulla, pons, midbrain, and spinal cord. So where do we typically take sections for these prion diseases? Where do we go? Not CSF. You're pointing in the right direction. Where? Not the whole brain. So midbrain area. So they have what is called it's a spoon. And this is what we do diagnostic. We're so creative. That has a sharp edge on one side. It's kind of like a little thing, and you stick it within the foramen. What's it called? The opening, the back of the head. Thank you. You stick it in there and you scoop off a circular section of that midbrain to deep medulla region, and you only test there because that is the primary area you find these prion proteins, not the whole brain. So when we do have cases of, not here, when I was in Tennessee, we did a lot of testing for chronic wasting disease because we had a lot of cases, and we would just get that one little area and send it off for diagnostics. A lot of them came sort of pons, medulla, midbrain area. Yeah. So this is an H&E section of a brain, and we're looking at, these are your glial cells in the periphery, and this is what we're looking at. These are neurons that have large vacuoles within the cytoplasm. That is highly diagnostic of one of these prion proteins. You have to be careful because there are some toxins. And I know Dr. Ogden talked to you about it. But there are some toxins that can cause similar presentation. So one, you look at it microscopically and then you do some more diagnostics to help you with that. We'll talk briefly about degenerative diseases. There are three terms that you should remember. Malacia means softening of the brain. Poliomalacia means softening of the gray matter. And leukomalacia means softening of the white matter. Okay, I've written the wrong thing here. Alright, what time is it? 10 until. Let us just do this before we. The last things we're going to talk about in leukoencephalo, we'll do that on Monday. Okay. Alright. Alright, these were rough because